Good morning, everyone. We are going to begin promptly. I'm Judith Rodin, the president of the Rockefeller Foundation and co-chair of the Oversight Committee for this important commission and its work. Thank you for joining us at the Rockefeller Foundation for the launch of this report. It is actually quite a stunning report because it presents very starkly the rationale for new thinking about the risks of deadly pandemics, and it offers much needed, quite excellent solutions. We know that widespread pandemics threaten human health and life, but even beyond their significant health impact, pandemics pose another triple threat, a threat to economies, to humanitarian progress, and to national security. Consider the following. Economic losses from pandemics are estimated at over $60 billion a year. In addition, humanitarian progress is often compromised. Countries hardest hit by the most recent Ebola epidemic are now suffering setbacks in hard-won social and economic progress that will really take years to restore. When pandemics do occur, they have the potential to threaten national security, killing hundreds, thousands, or sometimes even millions at a time, often more than global warfare. The 1918 influenza pandemic killed more people than World War I. Yet nations spend a small fraction of what they spend on defense funding on preventing such pandemic attacks. Given these significant implications, we can no longer view pandemics only through the lens of health. And this report begins to take us in a critical new direction. There are several people to thank for this. First, Victor Zhao, president of the National Academy of Medicine. Victor is our esteemed chair of the organizing committee for this project and was instrumental in the creation of this commission. We're grateful for all of the hard and capable work of the staff of the Academy in guiding and supporting this excellent work. I also want to thank Peter Sands for chairing this commission. Peter, you provided extraordinary leadership and were deeply engaged throughout the process, and we're very grateful. We were pleased to host the commission at the Rockefeller Conference Center in Bellagio for its meeting in November. And thanks to Larry Summers, our keynote speaker this morning, for his leadership over many years in documenting the economic benefits of investing wisely in health. We at Rockefeller had the pleasure of working with Larry last year on an economist declaration in support of universal health coverage, and we all look forward to his insights today. As you will hear, the Commission has a substantial number of recommendations which, if implemented, would lead to a stronger, more responsive, and more resilient approach to preventing pandemics and dramatically reduce the human, economic, and national security burden of pandemic risk. The commissioners will describe this excellent set of recommendations, but permit me to highlight just three themes. First, this report, unlike many others, focuses on how to pay for the great ideas that are coming, both from this commission and from other panels that have addressed the recent Ebola crisis. It contains a clear accounting of what it will take to make the necessary investments, $4.5 billion annually, and it provides a detailed roadmap for how this figure is achievable. Innovative finance will play a critical role to ensure that even the poorest countries are able to pay for such interventions. For one example, through our zero gap work at Rockefeller to close the financing gaps in development, we're supporting the Africa Risk Capacity's creation of pandemic insurance. This holds the potential to provide money to countries more quickly in the event of a pandemic and encourages public health investments to better prepare vulnerable countries for such events. Second, this report makes a strong case for the importance of building more resilient health systems globally. Health systems that are more aware and adaptive and integrated, bending instead of breaking under the threat of a pandemic. If we return to only funding silos, to building hospitals or community clinics or labs that are not linked in some internally aware, integrated, and adaptive system, then we really might have failed to meet the opportunity that we have now, this time, to get it right. Third, this report recognizes that addressing pandemic threats is certainly the responsibility of the World Health Organization, but also of the entire UN system, as well as donors and individual countries. When Ebola struck, it demonstrated how quickly pandemics become issues for presidents and prime ministers, not just for health ministries. As such, they require the leadership of the UN Secretary General, the World Bank, the broader UN family. Regrettably, however, attention is already fading from the lessons of Ebola as new urgencies turn our gaze. History, therefore, threatens to repeat itself unless substantial follow-up is sustained, unless decisions are made quickly and commitments are announced across upcoming global meetings from the World Health Organization, Executive Board later this month, to the World Health Assembly and the G7 Summit in Japan in May. Again, I emphasize it is not only the health of our people that's at stake. All indications suggest that we are just one major global pandemic away from significant economic and humanitarian catastrophe. If that is not enough to move us all to resolve in 2016 to make these recommendations a reality, I am not sure what is. I trust that it will be. And now it is my privilege to introduce someone I think is a fellow optimist, this morning's keynote speaker, Larry Summers. He is the Charles W. Eliot University professor at Harvard University, a columnist for the Financial Times, former director of President Obama's National Economic Council, and Treasury Secretary under President Bill Clinton. Here's Larry Summers.